Welcome, everybody, to Ask the Vet with Dr. Marty Greer, Revival's Director of Veterinary Services. I'm Shelly. I'm the Content Manager at Revival Animal Health. Let's start off with some of these questions. Linda emailed me and said she is struggling with Giardia with one of her 5-month-old toy poodle puppies. And she's asking for some suggestions to help eliminate Giardia and improve the puppy's quality of life.
And that's a really important question because we do see a lot of puppies with Giardia. We also see a lot of puppies with coccidia. So it can be really frustrating for people that are running kennels, facilities. Doesn't really matter where you have groups of dogs. We end up seeing a lot of these dogs ending up with Giardia and or coccidia. Of course, the two diseases need to be treated with two different drugs. So the first thing that I'm going to recommend is that you actually have an accurate diagnosis of Giardia so that you're not thinking that it might be Giardia and it turns out that it's actually something else. So stool samples should be run. Probably the best way to run them at this point, it's what we do in our practice, is we use IDEXX Labs. They have a fecal test that they run that includes a Giardia protein, looking for the actual protein of the organism and not just the organism itself, along with a flotation. So they look for the eggs for roundworms, hookworms, whipworms. They look for Giardia, and then they do an ELISA test looking for Giardia, roundworms, and hookworms. So that's a really comprehensive stool sample to have done and making sure that you're treating the right thing. And I don't want to get completely off track with Giardia here, but I will say that we get really interesting results back from the lab because sometimes they'll send us a result back that says we saw coccidia, but the Eimeria species of coccidia we saw is not a dog coccidia. So it's something that's just passing through the gut. That means they picked up something, eating rabbit droppings or something out in the yard that isn't going to end up being a parasitism. So before we start treatment, we want to make sure we're treating the right disease. If you have another reason for the puppy to have Giardia or to have diarrhea and you're assuming it's Giardia and you're treating for Giardia and you're not getting him better, that's probably one of the most common things we see. So for treatment, we recommend either metronidazole or metronidazole with fenbendazole at the same time. Fenbendazole is Safeguard, Panicure. There's a couple of different products on the market. We use the liquid because it's easier to administer to puppies. It's 1 cc per 4 pounds of body weight for fenbendazole, and you want to do that for 5 days. The label dose is accurate for the dose for the amount, but it only says 3 days on the label, and that's to get rid of the roundworms and hookworms. But if you're trying to get rid of Giardia, you need to go 5 days. And if you've done that, or you've done metronidazole and you're still seeing problems with Giardia, you can combine them and give them on the same 5 days. Metronidazole is one of the most commonly prescribed drugs for puppies and adult dogs with diarrhea. So it does a nice job for Giardia, but sometimes we're seeing resistance, or at least we believe we're seeing resistance. There's a fairly narrow margin of safety for how much metronidazole you should administer. We generally recommend somewhere between 25 and 50 milligrams per kilogram, which is a pretty normal dose. But if you get above that at 65 milligrams per kilogram, you can end up with toxicities, and the toxicities can be neurologic and pretty significant. So you want accurate weights on your puppies, and you want accurate calculations for the metronidazole, and that is a prescription item, so you'll have to talk to your veterinarian about getting metronidazole. Along with that, to improve the puppy's quality of life and improve their stool character, you can start feeding a highly digestible prescription diet. ID is one. Royal Canin makes a number of prescription diets. They make a GI puppy diet, which I think is really useful, but it only comes in small bags. So if you're trying to manage a whole litter, it might not be a big enough bag to get you more than a couple of days. But one of my favorite diets on the market for diarrhea, regardless of whether it's Giardia or not, is the Royal Canin German Shepherd diet. They make a German Shepherd puppy diet for puppies, and they make an adult diet. German Shepherds are kind of an interesting breed in that when they stress, they tend to stress through their gut, so they end up with diarrhea. So it's a really nice diet. You don't need a prescription for it. You can find it at the pet store, and you can find it online. So if you're having problems, you can have a Bernese Mountain Dog, you can have a Labradoodle, and they can still eat the German Shepherd puppy food or the German Shepherd adult food and get better stool quality almost instantly as soon as you change the diet. So if you're already suffering from diarrhea with your puppy, I tend to just immediately switch to the highly digestible diets and not do the gradual transition like you would if you were trying to change foods for another reason. you already have diarrhea. The faster you get them onto a diet that manages diarrhea, the better. So ID makes a couple of different products now. That's a Hills product. Purina makes EN, and Royal Canin makes intestinal diet. So you have 3 good lines of diets on the market that really can help with diarrhea. The third thing that I would do after the stool and the metronidazole with fenbendazole would be to add a good probiotic to the puppy's diet. And that's going to be something like Doc Roy's GI Synbiotics or Purina's Fortiflora probiotic. Those are really nice ways to establish the right bacteria in the gut and really help kind of straighten things out so that when you take the puppy off the medication that you maintain that good gut health. And then the fourth thing is to be really careful with not feeding rich snacks to the puppies. Some people use cheese because cheese is thought to be helpful in causing constipation, so you can use that to your advantage. You can use canned pumpkin. There's some nice things that you can use for snacks. You can use Cheerios, but a lot of the commercially available dog treats tend to be a little high in fat and a little high in some other things that are going to cause diarrhea. So I try to avoid those and stick to Cheerios, pumpkin, or some of the other things that are really good for GI health. So hopefully that whole package together will get your diagnosis correct and then get the right treatment started for your puppy.
Our next question today is, can Be Strong and DHA be given throughout pregnancy along with the Breeder's Edge Oxymate, or should I stop after breeding?
And I generally continue those. The DHA is really important for brain and eye development in the puppies. So you want to continue that. That's a fatty acid supplement. You definitely want to continue that to get the smarter puppies and to have the best brain development that you can. Be Strong, we use really frequently in the females to get them to come into heat and to maintain those good, healthy heat cycles. It is a B vitamin supplement. It's safe during pregnancy. So yes, you can absolutely use that. And then Oxymate, of course, is made for that as well. So those are all products that are fine to use during pregnancy and safe. You do want to avoid certain supplements. We avoid raspberry tea leaves because I am concerned about that causing some problems with bitches that don't maintain their pregnancies. And I worry about too much vitamin A, whether it's a vitamin A capsule or a vitamin A in the liver. If you feed too much liver to the dogs, we can end up with midline defects like cleft palates and open abdominal walls. So do be careful with your supplements. But the 3 that you just mentioned are all safe. The other one that didn't get mentioned there is folic acid. And we definitely want our girls on folic acid, especially if they're the brachycephalic dogs that tend to have cleft palates in their genetics. We can reduce, even with genetic tendencies, we can reduce the cleft palate incidence by about 30 to 50% by increasing the folic acid. And that should be started about 6 to 8 weeks before the pregnancy so that we don't wait too long to start it. It needs to be started prior to the pregnancy starting.
Okay, thank you for that answer. Michelle is wondering, she says, I have had litters of puppies that are well at birth and for about 6 weeks and stop eating. They become pale, very dehydrated and thin. She's used sub-Q fluids and antibiotics on board. Then they struggle and pass away. Different breeds, small and large. Any advice, suggestions there?
Yeah, there's a lot you can unpack with this question. So the question was going to be whether we have a diagnosis for what happened. So if you are losing puppies, you probably want to get postmortems or necropsies done on them because you can't afford to continue to lose puppies without a diagnosis. So speak to your veterinarian about whether they can do a postmortem in their office or whether they can submit the puppies to a diagnostic lab for a diagnosis. It tends to cost in a couple of $100 range, which if you lose a couple of puppies, you just can't afford to lose them. When puppies are as valuable as they are, especially right now, we don't want to lose puppies. So get a diagnosis. I would ask what you're doing for feeding, what kind of products that you're feeding to the bitch and to the puppies. We avoid the raw meat diets. And I tend to use a puppy diet for the bitches and the puppies. So by 6 weeks, they should be weaning. And there's not any information in here about what you've got for your weaning diet. And then, of course, parasite control. Parasite control should be started when the puppies are 2 weeks old and should be given on a weekly basis with Nemex or pyrantal pamoate, starting at weekly at 2 weeks of age, unless the bitch was on the panicure protocol that we do to prevent the parasitism that we use during pregnancy. Most puppies have at some point some exposure to a parasite, so it's really important that you're deworming. So you can start at 2 weeks with pyrantal, and then by 6 weeks you can switch over to panicure or fenbendazole. But make sure your parasite control is good. And the other thing we can see with pale puppies and dehydration is flea infestations. It's hard to imagine you could get enough fleas and flea bites to cause the puppies to be anemic or pale, but not only can hookworms do that, but external parasites such as fleas can as well. So be very careful with your parasite control. And of course, I'd want to know a lot more about environment, diet, vaccination history. There's just so much here in this question that it's hard to give you a good one-note answer.
Okay, sounds good. Okay, another question here. Is there a way to cleanse a nasal passage for a 4-year-old Pomeranian? I cannot say that word today.
Pomeranian, yeah.
Pomeranian. It sounds like she's congested and blowing through her little nose. Any suggestions there, 4-year-old?
Yeah, that's a good question too. So we can see some of these dogs, even Pomeranians that have that shorter nose, they can end up with an elongated soft palate, which is the soft part at the back of the roof of the mouth. That can be too long, can cause congestion. That can be diagnosed by a veterinarian that would anesthetize her or sedate her and take a look. Sometimes we'll take an x-ray to look to see if their trachea is normal in size. Pomeranians and some of the other toy breeds have collapsing tracheas, so they can be congested. If it seems like it's really more nasal, you can certainly use a nebulizer, and you can use products like little noses that you can buy at the store, at the over the counter at Walgreens or Walmart or Target, whatever, that have a nose drop that you can use, and that will help clear the congestion. So then the other question is there another problem? Does she have allergies? We typically don't see allergies causing the respiratory problems in dogs that we see in people. They don't tend to get hay fever, but it's possible. So I'd be looking at what the underlying problem is, not just to try and resolve it, but find the underlying problem. Is it seasonal? Is it year round? We need more information, but that's where I would start looking.
Okay, Lisa is wondering, can a human B complex be given since it is water soluble?
It can, but the B complex, like B strong, is really formulated for dogs, and we've seen some really nice improvement in the ability for bitches to cycle and for them to become pregnant and maintain pregnancies. So it's made for dogs. It tastes good. It comes now in multiple forms, so it's not just the liquid anymore. It's been reformulated, so it comes as granules and chews. So I would take a look at the B strong products that we carry and stick to a dog product when there's a dog product on the market that's available.
Okay. Another question, how early can I give pumpkin to a Frenchie puppy? Also, can I give salmon oil to a pregnant lactating female, and how soon to a puppy?
Yes, you can. So canned pumpkin in small amounts for small dogs and bigger amounts for big dogs. So if it's a little bitty puppy, by the time they're 6 weeks old, there's no reason you can't give a little pumpkin. I guess my question would be whether you think you need it because they have diarrhea. If they do, then I would find the underlying cause. If you're giving it because you just like the idea of pumpkin, that's fine. It's good stuff. Be aware though, most canned pumpkin that comes in the can at the grocery store, that's actually usually squash. It says pumpkin on the label, but somehow they are able to label that as pumpkin when it's really not. And salmon oil, yes, that is safe during pregnancy. That's one of our DHA sources for the brain and eye development that we mentioned a few minutes ago. So salmon oil is fine. You want to make sure that it doesn't have vitamin A in excessive amounts, but salmon oil is good. And a lot of people use it for the DHA in pregnancies.
Okay. Daniela is wondering, recently my dog vomited white foamy substances, and every time I feed her, doesn't even touch a single portion of her, but she keeps on drinking water, I believe. So what should she do in that situation? So it sounds like she's vomiting this white foamy substance, not really wanting to eat, but is drinking.
Yeah, that's something I think you need veterinary attention for. If you have a dog that's not eating and they're losing weight, you need to get in to see a veterinarian and find out what the underlying problem is. If you may need blood work, you may need x-rays or ultrasound for imaging, but a dog that's vomiting and not keeping food down definitely needs to be seen. Now, if it's just a little vomit here and there and the dog is overall eating and seems well, otherwise, Pepcid works pretty well. You can buy famotidine or Pepcid AC over the counter, but if you have a dog that's that sick, you need veterinary attention.
Okay, our next question is, let's see, can I give panicure instead of pyrantal to a 2-week-old? I know everyone says Nemex or pyrantal 2 and 4 and then panicure, but if it's okay, I'd rather do panicure since it has a broader spectrum.
Right. And panicure is not labeled for puppies under 6 weeks of age. So unless you have a really unique situation, I would stick to Nemex, parental. That we know is safe in puppies at 2 weeks of age. So I would avoid the panicure until they're older. It's not, it's easier to give the Nemex. It tastes better. And you can give it once during that time period, and then you don't have to repeat it on a daily basis. When you use parental, it's just one dose. When you use fenbendazole, it's for 3 consecutive days for parasites other than Giardia and 5 days for Giardia. So stick to your Nemex.
Okay. Michelle is wondering, I have had mycoplasms diagnosed in some pups last year, snotty noses and cough, but was diagnosed not to be kennel cough. Was thinking other things such as herpes virus. Any other thoughts on that?
Yeah, there's a whole multitude of diseases that cause respiratory disease in dogs. They fall under the category of it's CIRD, canine infectious respiratory disease. So there's herpes, there's a corona, there's so yes, there's a coronavirus in dogs, but it's not the same one that we're seeing in people. There's probably rotaviruses. There's Bordetella, there's parainfluenza, there's adenovirus. There's a whole array of viruses and bacterial diseases that cause respiratory disease in dogs. So there's not one good solid answer. Most of them do not respond to antibiotics because most of them are viral, but they may set the dog up for a secondary bacterial infection. So that's why we may reach for an antibiotic if that's the case. So yeah, there's so many to choose from. Yes, herpes is definitely one of them. And unfortunately, in the US, we can only vaccinate for Bordetella, parainfluenza, and adenovirus. We don't have vaccines for herpes virus and some of the other diseases that cause respiratory disease. I was really hopeful when Zoetta started talking about CIRD at some of their educational meetings that meant some new vaccine was coming, but we haven't seen anything yet.
Okay, next question. Do you believe it's better to time breedings using medications such as cabergulene or a natural?
Natural breedings all day long if I can do it. The only time we use cabergulene or other drugs to induce a heat cycle is if it's a bitch that just doesn't cycle. And occasionally we'll see one. She may have had a heat cycle when she was 2.5 and now she's 4 and you haven't seen one. So the question is, did she have silent heats or did you miss them or does she just not cycle? So yes, we can definitely induce heat cycles, but we try to avoid that because I think you always end up with better fertility. Now, that being said, there was one female that we bred a number of years ago that had 16 puppies. She's a 37-pound Springer. She had 16 puppies on an induced heat cycle. But there are also papers that report that they have smaller litter size. So I try to let bitches do what they want and let Mother Nature take over for us. But when we have to kind of nudge them into heat, then there are definitely things that we can do with that. In fact, I ultrasounded a bitch yesterday that's pregnant with a small litter, but is pregnant nevertheless on a bitch that was never seen to be in heat. So we know they're girls, but you can also have those bitches that look like girls from the outside and they're actually some form of intersex, so they may not actually have ovaries and a uterus. So if you've never ever seen a heat cycle, that might be something to talk to your veterinarian about, looking to see if the dog is actually a female chromosomally, genetically. So keep that in mind.
Okay. Lisa says, I will be having my first litter of Greater Swiss Mountain Dogs soon, and that's exciting. And I am aware that they often have uterine dystocia. How do I decide if I should schedule a C-section or let my bitch try to deliver on her own?
Oh yeah, Greater Swiss Mountain Dogs and Bernese Mountain Dogs tend to have a lot of uterine inertia. So the first question I would ask is what her maternal history is. Did her mother go into spontaneous labor? Did she successfully deliver a whole litter, or did she need intervention? And if she needed intervention, what was the outcome? And then of course, it'll depend a little bit on what you have for emergency care as well. So if you're in the boonies and you don't have an emergency clinic or a veterinarian that's close to you that can help you in the middle of the night, that's what you need to kind of plan for. Unfortunately, right now, most of the emergency clinics are so backed up that there are 6, 7, 8 hour waits to get in. So by that time, you're probably going to start losing puppies. So we know we get larger numbers of puppy survival from C-sections than from vaginal birth. Paula Moon's study showed that we see about 5 to 6% more live puppies at weaning than we did if they were born by C-section than if we did natural birth. The other question would be, how many puppies is she going to end up pregnant with? And of course, until you have an x-ray, you don't know. But our rule of thumb is if there's 1 to 2 puppies or more than 9, we automatically schedule a C-section. But a lot of Greater Swiss Mountain Dogs and Berners will have their first 2 or 3 puppies, and then they're like, I'm good, I'm done. So unless you're well equipped with calcium gel, injectable calcium, oxytocin, I wouldn't try it on my own. The other thing you can use is Whelpwise. Whelpwise is a uterine contraction monitoring service based out of Colorado. They ship equipment to you. So as soon as you confirm a pregnancy, you need to contact them because they don't have a surplus of equipment. They're pretty short. So you contact them, you get the equipment, you have it available. And when she goes into labor or a day or 2 before, you start putting the uterine contraction monitoring device on it. There's a little transducer that goes on the bitch's abdomen. And for an hour in the morning and an hour at night, you collect the data. And they can tell you prior to her going into labor and prior to having puppies and during labor, they can assess the quality of her uterine contractions and can help you to give calcium and oxytocin at an appropriate dose to manage that labor. And if she's not progressing on that basis, or the fetal heart rates start to drop on the fetal heart rate monitor that's also included, then you can intervene and be more prompt in getting a C-section for her if it's necessary. But Greater Swiss they're one of those breeds that are just tough to whelp. So I'd want to know a lot more about her mom.
Okay. Somebody is wondering how to treat E. coli and different bacteria in the nose.
I don't think I've ever diagnosed E. coli in the nose. So I would get a culture and see what antibiotic is working, but I would also want to know why the nose was cultured, because that's not typically something we would do. So again, there's pieces of information here that we need to know more about to treat. That's an unusual thing, and I would be looking for the possibility of a foreign body or some other underlying problem that would cause the dog to have a chronic nasal discharge.
Okay, good to know there. What can I give a 1-week-old French puppy for diarrhea? Also, how can I soothe his backside that it is super irritated and for overstimulation?
My favorite thing to use for diaper rash is diaper rash cream. I go to the store and I buy Decidin, that white stuff, the zinc oxide. It really works well. There's a lot of topical products that we have on the veterinary side, but we don't have a diaper rash cream that does anything as well as Decidin. As far as diarrhea goes in young puppies, I would make sure you were giving a probiotic to help get things started so that the right bacteria were in the gut. And the gel, Dr. Roy's Symbiotics, is really easy to administer to puppies. You may want to use some Nurture Mate along with that to help get the right kind of GI health going. And then you can use kaopectate, but not the human kaopectate. There is a veterinary kaopectate that you want to use. The human kaopectate is really the same thing as Pepto-Bismol, and it metabolizes into an aspirin metabolite. That's not good for babies. That's not good for moms. So I only use the veterinary product. Comes in gallons, comes in pints, works really well. And on a little bitty puppy, I would do 1 cc every couple hours until the stool started to return to normal. So it's easy to give. Just give it orally with a small syringe.
Okay, next question comes from Mindy. She says, I have Gerardia that is in my soil and I've been unable to get rid of it. Most of the time they are on the concrete or artificial turf, but I do allow them in the grass as well. My last litter didn't get it, but that was a winter litter. I disinfect with ProVet Logic outside and steam mop and clean with Efferson at least twice a day. Their bedding is cleaned 2 times a day and as needed, and I use Efferson on the laundry and toys. Any suggestions to mitigate it?
Unfortunately, there's no disinfectant that kills Giardia. The cysts are really effective at staying alive in your soil and your grass. Some people talk about a flamethrower burning your grass, but you want to be careful you don't burn down your house. So I'm not making that recommendation. No, there's really not a good product. So you may just have to keep ahead of it with fenbendazole on a regular basis. And the bitches, it doesn't transmit from the mother to the puppies through the placenta or the milk the way that some of the roundworm and hookworm eggs come through, but they can come in even as really young puppies. If the bitch went out and had a little diarrhea on her coat and then the puppies kind of swarm her when she comes back in and they get it, then they can be exposed at a very early age. So You'll probably want to wash the bitch's feet off and make sure that she's good and clean after she goes out and has a stool, so that she's not bringing it into the whelping box when the puppies are really young.
Next question has to do with tick repellent. They're just kind of wondering, what do you recommend as far as, the best tick repellent?
Yeah, so the question has a bunch of holes in it. So my question would be the age of the dog, what your environment is, and whether this is a dog in a breeding program. I think the best repellent are the topicals, the ones that actually keep the ticks from even getting on the dog and staying on the dog for more than a few minutes. Those are going to be things like Vectra, Frontline, Advanix. There's a lot of good ones on the market, but they are not all labeled for use in breeding and pregnant dogs. And remember, breeding dog means breeding dog. So that may mean she's 8 weeks old. She's not old enough to breed at 8 weeks, but if she has a future in your breeding program, you need to look at her as a breeding dog and not just any other dog. So the Seresto collar works well, the topicals work well, but many of them are not labeled for use in breeding dogs. Frontline is, Vectra is not, Seresto is not. So those are all really important things to investigate. And actually, we have a flea and tick finder on the Revival website that helps walk through that process of what are you trying to prevent, fleas or ticks, how old is the dog, and what is their reproductive status. So that's a really useful tool. We also have a small chart that we use when you call into the PCPs, the phone staff at Revival, that can help walk you through this as well. The orals are also very good, but they don't repel the ticks. They kill the ticks once they're biting the dog. The only one of the 4 oral medications that are labeled for use in pregnant and breeding dogs is Bravecto. They make a Bravecto 3-month, and they also now make a Bravecto 1 month for puppies. Not that the 3-month was bad for puppies, but the puppies changed weight sizes so much that they weren't accurately dosing it. So the FDA made them do a 1-month product. So Credelio, NexGard, and Simparica are all the other 3 oral flea and tick medications that kill fleas and ticks, but they are not labeled for use in reproductive dogs. And I don't think your dog should be the one that you experiment on. I think you should stick to the products that the companies have done the research on and we know are safe. So that's going to be Bravecto, and probably Frontline would be my other choice if you're looking at a topical for more of that repellent hot foot kind of effect, where the ticks get on the dog and they dance around and they hop right back off. It's pretty fast.
Our next question has to do with vaccines. Someone is wondering, what is the difference between the feline triple vaccines, Elanco or Merck? And do you recommend one over the other?
Well, I use the intranasal product, and I have for the entire time I've been in practice, which is almost 40 years. That's kind of hard to imagine, right? So I use the intranasal. It's made by Heska. It's marketed under another label, Diamond, I believe. So that comes with panleukopenia, rhino, and calisi. And I like the intranasal product because you get good immunity. You don't have to worry about vaccine injection site reactions like we do see in a very small percentage of cats. You don't have the effect of the injection, and it gives you local immunity. So right where the virus comes into the body through the nasal passages, it blocks the virus. So it's actually a pretty cool product. And remarkably, I've done this for a long, long time. The cats are actually better about nose drop vaccines than the dogs are for the nasal bordetella. And that kind of surprises you because you think dogs are better with water. Cats are not, but the cats are actually very tolerant of the nose drops. So it's just a very small dose, and that's my preference. Otherwise, I think all the products on the market are good. I just like the intranasal because it doesn't give you the reaction site concerns and some of the other worries that we have about vaccinating felines.
Okay. Sandy is wondering about Giardia. Again, does the wishywash system kill Giardia?
Nothing kills Giardia. Burning down your kennel kills Giardia. That's it. No, seriously, there's not a disinfectant that's labeled for use in eliminating Giardia. In hog raising facilities, when they have coccidia, and again, I don't want to confuse the two, but they're both one-cell parasites, so they have some similarities in that we don't have a disinfectant that kills either of them. In hog facilities, they're all in, all out facilities. So they move all the sows in, they have their babies, they move them all out when the babies leave, and then they paint the surfaces in the entire hog barn with a fresh coat of paint, and then they bring in the next batch. So their facilities are not rotating facilities where they have dogs coming in or commingling. The pigs go in as a group, come out as a group. So you may have to resort to something like that if you're really struggling. There are swimming pool paints and other kinds of products that can seal the surfaces of concrete. But as far as grass and concrete go, there's really nothing that kills it.
Okay. Michelle is wondering if you could tell a little bit more about using Marquis for coccidia, like how is that?
That's a loaded question. I don't touch it. I just don't use it at all. It comes in a big tube. It's meant for a horse at 1,500 pounds. And when you try to dose it down to the right dose for a 2-pound puppy, I think you're going to have the mistake of misdosing it. So I just flat out don't use it. I use Albon. I'm very happy with Albon. I hear people say that they don't think it works. I have yet to see a case of coccidia resistant Albon. If you weigh the puppy and accurately dose the medication and use the Albon suspension, it tastes good. It's easy to give to them. Yes, you have to give it for 5 days. I know Marquis is labeled for 1 to 3. But I just don't think it's safe to try to estimate the size of the puppy and get the right dose when you've got a great big tube of medication that was really not designed for use in dogs. I just flat out don't use Panazaril or Tetrazaril or any of those. I stick to Albon. If it's on the label, it's labeled for dogs. If you have a reaction to it, if something doesn't go well, the company stands behind Albon. You're on your own if it happens with an equine product that was really not labeled for dogs.
Okay. Yeah. Checking labels is always important.
Yeah.
Okay. Next question. I have a female Frenchie, almost a year old, for my breeding program. She is too hyper and never stays still, always breathing heavily. Is there a supplement that I can be giving to her to calm down?
Yeah, and I think the 2 things I would do would be, I would use Adaptil, which is a pheromone. It comes as a collar, it comes as a room atomizer, a little sprayer, and it comes as a little thing you plug in like those Glade air fresheners. And it emits a pheromone that is a calming pheromone for the dogs. So that's a good place to start. The collar is nice because it goes wherever she goes. So if she's not in one room or one small part of the house all the time, that collar's with her all the time. If she's in a kennel or a small apartment, the room type of products are probably fine. The other thing to look at is Purina makes a probiotic called Calm, CALM, like calming. And that is supposed to also get the right bacteria in the gut to help calm the dog. So those are both safe during pregnancy. You can use those. It wouldn't be a concern for a dog that's a breeder. A lot of the other products that we have that are anti-anxiety or sedatives are not labeled for dogs that are pregnant. So I would stick to something that I thought was along those lines. And if she doesn't settle down a little bit, she might not be great motherhood material. She may just not be the kind of dog that lays down and takes good care of her puppies. But some of those girls really do surprise me when they do have puppies. So it's a little risky to breed a dog that you don't think is going to be a calm dog. But if you want to use those 2 products, the Adaptil and the probiotic Calm by Purina, those would be the things I'd try.
The next question. A friend of mine has several bitches and none of them are having heats. It has occurred for 2 or 3 years. Why might this be happening? Thanks.
Yeah, and I look at nutrition first on all of these cases, and we've had several of these come in where the bitches are on a diet that just isn't complete enough. It doesn't have some of the micronutrients in it. The label may look okay. It might look like a different product that you have on the market. But I look at nutrition as the very first place that I start. We've seen too many of these end up with a problem. So I would start by either feeding a Royal Canin diet, and Royal Canin makes the only pregnancy diet on the market. It's called HT42D. It is made for bitches that are in heat and in their first 42 days of pregnancy. But if the bitches aren't cycling, I would very comfortably put them on that to see if you could get them to cycle. The other alternative, if you prefer not to use a Royal Canin diet, would be, well, you could use a Royal Canin puppy diet or Purina, the Sport 30-20 diet. We see really excellent heat cycles on the Royal Canin diets and on the Purina diets. So that's where I would start. Reading the label isn't always everything you need to know about a nutrient profile. And when you look at ingredients, I know there are people who are offended by things like corn, but really those are perfectly acceptable nutrients and appropriately formulated. A lot of these dog foods do a great job. So absolutely, hands down, we had a client that called me 2 years ago that had a similar situation. He had a kennel full of bitches. It was a 50-year-old line that his in-laws had started, and his females were not coming into heat. And if they did come into heat, he was not getting them pregnant, but the bitches that came from the outside that he was using his stud dogs on were conceiving. So he came to us, well, he called us, and I asked him a pretty straight question, is what are you feeding? And he said, I'm feeding a really great diet. And I'm like, okay, tell me about it. Well, it turns out it was a diet that was made at his local feed mill. His in-laws used to raise mink, and a lot of mink farms made their own formulas. And that's in fact how some of the pet food companies like Fromm started, was with a mink diet that was then transitioned to being a dog food company. So he went to the feed mill and he asked him how they were formulating the food that he'd been feeding for the last 2 years. And it turned out that there was a vitamin pack and a mineral pack that they were not adding to the food. And I don't know if somebody forgot at the feed mill, if there was a change of staff, or if they thought it was too expensive. I don't know how that decision was made or accidentally happened. But by the time he came in, I had him switch to Purina. By the time he came in, he already had 2 bitches in heat. The first bitch that came in was an older bitch, so we progesterone timed her. She was pregnant when I saw her 4 weeks later. The other bitch, he chose not to progesterone test. She did not ovulate on that heat cycle. We found that at the ultrasound. And so he then just gave her another heat cycle, and she came back into heat and ovulated. And he is now very happy because he's got bitches that are pregnant again. So really, we underestimate the importance of good nutrient profiles. So really take a good hard look at your food. I don't like the grain-free diets. I don't like the raw meat diets. Those all cause us to have either infertility problems or parasite and bacterial disease. So if you're reluctant to change and you have 10 dogs, then try 3 of them on a different food. You don't have to change everybody. Try 3 that you really want to have come into heat, and then give it a try and let me know, because I'm going to say probably 90% of the time that's going to solve your problem.
Okay. Next question is from Nina. She's wondering, have you ever rescued puppies born at day 53? If so, how did you save them?
Puppies that were born on day 53 of the pregnancy are typically not viable. Now, pregnancy is highly variable if you count from the breeding date, but it is very specifically 63 days long, plus or minus 1 day, if you count from ovulation. So if you're talking about from an ovulation date, I don't think you have a chance of saving them. We occasionally will see 59-day puppies that survive and 60-day puppies that survive, but typically they need to be 61 days to 65 days for survival. So it's a pretty tight window. So I would have to know how you're counting your days, but I'm going to say your chances of saving 53-day puppies, their lungs are not developed. They don't have the surfactant that they need to breathe. So you're unlikely to save those puppies.
Okay. Next question. What vaccine is best to give puppies in what order? First Neopar or puppy DPV?
I start, like my own dogs, I vaccinated my own litter this week. They're 8 weeks old. They got their first distemper vaccination with distemper parvo. I use either a Zoetis or a BI vaccine, Elanco, Salve, one of those products. Other people really like the Neopar product. It is labeled for use in younger puppies, but if you're not having parvo or other kind of outbreaks, I typically will go between 6 and 8 weeks for my first vaccination. If you have a larger facility where you have outbreaks, you might have to do something different. You might have to step that into the 4 to 6 week time window. The other thing to consider is if you have a small number of girls, or if you're having problems with parvo, the University of Wisconsin, their CAVID lab, CAVID, has Dr. Lori Larson, who followed Dr. Ron Schultz, who's an immunologist. And they have developed a test that's a titer, which tests the antibody levels of the mother. And if you test that and then ask for a nomogram, there's a little box to mark on the form. You can download the form and take it to your vet and have them draw the blood and send it in. That nomogram then calculates based on the mother's antibody levels when to vaccinate the puppies. So you can customize vaccine protocols for each litter, which is really pretty cool because a lot of people don't want to vaccinate so frequently. They don't want to do 4 vaccinations when the puppies are small. So they'll do this customized program, and then you know exactly what vaccine to give at what time period. It's a really slick product. So it's called a nomogram. And like I said, it's at UW, Wisconsin. And that's Dr. Lori Larson and CAVID, CAVID lab. So it's a great resource if you're struggling with vaccine protocols.
Okay, Michelle is wondering if you could talk a little bit about, and I'm probably going to say this wrong, segmentazole for Giardia.
Yeah, again, I don't use it. Okay. I use fenbendazole. I stick to the products that are labeled or that we have a lot of experience with, again, because of the dosage. I don't know if anybody remembers, but probably 10 or 12 years ago, There were polo ponies that were brought over on a boat from Venezuela, landed in Miami. They unloaded the polo ponies, and they were injecting them with vitamin E and selenium because it's supposed to help their muscle tone and improve their performance. They unloaded 27 polo ponies. As they unloaded them, they injected them, and 26 of those 27 polo ponies died on the spot at the site. The pharmacy that did the compounding miscalculated the dose and killed 26 very valuable ponies. I just don't mess around with stuff like that. If it's not labeled for use in that species, I want it either compounded by a compounding pharmacy so I know it's accurate, or I don't use it. I use products that are labeled. We have lots of great products on the market. If we didn't have a good product, I would use it, but we have good products that are labeled for use. And so that's getting into an extra label or an off-label dose, and that's asking for trouble. If you run into a problem, the company's not going to back you up. If you lose puppies to another product that's labeled for dogs, they're going to stand behind their product. If you're using an equine product or a product from outside the United States, you're on your own. I don't do it.
Okay. Somebody's wondering if you could talk a little bit about insemination, kind of the best time to inseminate, and a little bit about that.
Sure. So for fresh semen, we inseminate 2 days after ovulation. With frozen semen, it's 3. That's in our hands, in our lab, and that's what works really well for us. Ovulation in our lab is typically called a 5, but it's somewhere between 4 and 8 nanograms per mil. I strongly prefer timing the females with progesterones instead of just looking at their behavior and when they'll stand and when the male is interested. The 2 reasons I really like it is, number 1, we get more females pregnant doing that protocol. And number 2, if I have a high-risk pregnancy, a dog that needs a C-section, a pregnancy that's not going right, we need to intervene with supporting the pregnancy or manage that high-risk pregnancy with the high-risk puppies. We can do it much more effectively if we know the due date. So I strongly encourage people to do progesterone timing. And there are certainly products on the market. There's a lot of veterinarians that are doing these. There's other equipment that's coming to market out there. So I think we need to look seriously at using progesterone so that we're much more effective in saving litters. The amount of money you spend on progesterones is a small amount compared to missing a pregnancy or losing puppies because you didn't have the information you needed for the due date.
Okay, Corey is wondering, do you look at nutritional or supplement approach differently for live cover breedings versus TCI or AI breedings?
Not really. Pregnancy is pregnancy. Doesn't matter what kind of sperm you use or how you get it there. You still need to have pretty much the same nutrients for those females. And the boys. We can supplement the boys too.
Okay, can't forget about the boys.
Yeah.
Mindy is wondering, she says, I have a female that has been supplemented with progesterone for 2 litters when she got to 5 ng per mil progesterone and had C-sections. The first was elective due to litter size. Second was emergency, as she did not have her puppies even with contractions. Her last litter, we followed her progesterone and did not supplement, and her progesterone stayed above 3 ng per mil, and had her litter on day 63 post-ovulation and whelped naturally. When do you supplement progesterone?
It depends on how far away the dog lives from us and what the skill set of the owner is and what the history of the female is. There are 2 reasons that progesterone drops. There's a primary cause and a secondary cause. Primary means that female did not make enough progesterone in her ovaries to maintain a pregnancy. If that's the case, that's going to happen with her every single pregnancy she has. So it's important to know whether that's what's going on or not. And we also probably see a familial tendency to that. So if her mother dropped her progesterone, she may as well. So keep in mind, if you're perpetuating that, you're going to be chasing this down your genetic line. For some dogs, that's what a risk that clients are willing to take because they're such an important dog in a breeding program, or the breed is so rare that they need to do that. For other females, that's a female that breeders may want to choose to not breed again because they don't want to perpetuate that and have the next generation and the next generation do it. The secondary reasons for low progesterone are going to be infections, illness in the female, some other cause. We've seen Lyme disease cause it. We've seen diabetes cause it. You can certainly see a number of different disorders that can cause the progesterone to drop. Herpes virus, if the puppies get if the bitch gets herpes virus, the puppies get sick, and then her body tries to get rid of those puppies that aren't doing well. So her progesterone may drop prematurely. That's not going to happen every litter. That's going to be a one-time thing with an unfortunate event that happens during a pregnancy gone wrong. So if we know they need to stay above 3 to stay pregnant, if you live 2 hours from me and it's Saturday at noon and you have to get through the weekend, I may supplement at a 5. Whereas if you live 20 minutes from me and it's Monday afternoon and you can come back Tuesday morning and have another check done, I may not supplement until they get below 3. So again, it depends a little bit on the history and the circumstances. So I kind of play that by ear. Some people, they've got a lot of great veterinary support available and other people don't. So you really need to know that information.
Okay, I've heard that there is more laxicity showing in OFA radiographs for dogs that are sedated, and some vets in my area are offering them unsedated. Would you recommend with or without sedation?
So I have done OFAs for 39 years, and I rarely sedate. OFA likes you to sedate. Some states require sedation so that the staff doesn't have to stay in the room with the dog during the x-ray. For instance, New York, I believe, requires no staff in the room for an x-ray. So again, the answer is it depends. That's a good solid, it depends today. So it depends on the dog. If the dog is fearful, if the dog is upset, then I think sedation is an appropriate thing because we don't want to make these dogs afraid of the veterinary clinic. Other dogs are quite self-confident and they're great and they'll lay still and they'll cooperate for us. So it'll depend on the size of the dog, the strength of the dog, the level of cooperation I get, and their level of fear as to whether we do it that way or not. But most of our dogs are unsedated. I have done both on my own personal dog just to see if I could see a difference. I don't see a difference. I don't think the hips look all that loose and sloppy. It's more a matter of I try to save sedation and anesthesia for things that really require sedation and anesthesia, because I figure every time you do that, there is a small, albeit small, but definite risk. So I try to avoid any of those drugs if we can avoid them. Sometimes just giving the dog gabapentin or trazodone before the appointment is all it takes for the dog to be a lot more collected and calm during the procedure. Now they have to lay on their back in a dark room with strange people wearing lead. So a lot of people are like, oh, my dog's great. He'll lay on his on the couch on his back all the time. Well, it's different in your living room than it is on my exam table. So it does make a difference. And some dogs really, they've got it all together and they're fine and they're confident and they're good. And other dogs, you're going to scare them. So it's not worth causing a fearful event in a dog by just saying, I'm not doing that. So you have to really make decisions on each individual dog's personality.
Okay, next question. My male pom has never shown an interest in bitches and heat. He had his testosterone and it was very good. We have tried to collect from him with no success. What could be going on?
Well, some dogs are like that. It's possible in a lot of settings that the dog has been told no too many times when he started to mount females or mount other dogs in the household. So he has been trained not to do that. Dogs, we don't think dogs are gay, so we can't blame, any kind of orientation on that. So we don't think that happens. But some dogs have just been shut down. They've been told no too many times. And so when the answer is really yes, that the dog is reluctant. So I would just practice a little bit with the dog. When you have a nice cooperative female, get him used to being handled. The biggest problems we've seen in dogs that are reluctant to have semen collection done are the dogs that were imported from Europe as older dogs. I don't think that the Europeans handle their dogs the same way we do, but a lot of the pet dogs that we see are more of a problem than the kennel dogs or the dogs that are meant to be in breeding programs. So it tends to be the pet dogs, but a lot of the little dogs are kind of soft and they've been told no, and they just don't think they should do it. We've also seen dogs, unfortunately, that have had shock collars on them for hunting dogs and performance dogs. And so they've been shocked for sniffing a female in heat. So you can imagine if you've had a negative experience around a girl, or one of the girls was snarky with him. He was thinking that maybe she was getting close and he tried and she turned around and snapped at him. He's going to be reluctant. So it does take some practice. There is a learning curve with it. We can usually get that to happen. There is also HCG, which is an injectable prescription drug that can be used to help improve libido. And that can be given by a veterinarian. It has to be prescribed by a veterinarian. But It can be given on a weekly basis, once a week as an injection, until the dog develops enough confidence and enough libido that can help him. It also might be a self-confidence thing. So he might need something for anxiety. So there's several ways to approach it, but mostly it's just, he's got to practice. He's got to understand that it's okay that he smells a female and that he has an erection and that he has a collection. So you just need to do a little practice.
Okay. Michelle is wondering, what is your take on older males as far as producing litters? I've had semen checked and are plenty and swimmers. However, with 8 females and AI breedings, the female does not conceive. Is it possible the semen are not strong enough?
Yeah. 8 misses is a pretty good indicator that there's something not right. So the first question would be whether he was ever fertile, or if this is a dog that you didn't use when he was young, so we don't know. There are definitely some DNA defects that we can see in dogs and other species that can cause infertility. And there's a test for it, so you can have the semen checked for that. The other thing that can cause a problem is going to be either low sperm counts or poor prostatic fluid quality. Once dogs reach the age of 5, their prostate changes, so they produce a different kind of testosterone. So that can certainly change the quality of the prostatic fluid, which can mean that the semen doesn't survive as well in the female's reproductive tract. Or his sperm count might be lower. So you want to get, not just look under the microscope and say, yes, I see sperm swimming, but you might need to actually get a sperm count. And we should typically see 10 million sperm per pound of body weight. So a 50-pound dog should have 500 million sperm, a 100-pound dog should have 1 billion sperm. There's a pretty simple calculation to say if your dog is producing what we would expect to be a normal amount. And we know we need at least 1 to 200 million sperm in a collection for a female to get pregnant. So without a sperm count, I can't fully inform you on that. There are ways to improve semen quality. There are ways to improve prostatic fluid quality with a prescription drug. So there's certainly things you can do, but you need to see a veterinarian and get a diagnostic workup on this guy.
Thank you, everybody, for joining us today. Find us on Facebook, Instagram, Twitter, YouTube, and keep learning, keep growing. Thank you so much, Dr. Greer, for joining us today. We really appreciate all of your pet health knowledge.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.